here?
Yeah, pop it up.
All right, good morning, students. This is week 3, and we are discussing chapter 2. I assume that you have already read this chapter, and we have much to talk about this morning. These are the learning objectives. Define terms relevant to the quantitative research process. Those terms are basic research, applied research, rigor, and control. Okay? So the second one is compare and contrast the problem-solving process, nursing process, and the research process. Identify the steps of the quantitative research process in descriptive, correlational, quasi-experimental, and experimental published studies. Read quantitative research reports and conduct initial critical appraisals of quantitative research reports. So these are the learning objectives, and your quiz items will come from these objectives that we cover each week. If you have any questions on that, you can email me or you can call me during office hours. You know, office hours on Monday afternoon, 2 to 6. So, what is quantitative research? Quantitative research is probably something you are somewhat familiar with. You've already had a statistics course, so there had to be some discussion of quantitative analysis in that course. So the research process that uses a quantitative approach is a very formal, objective, rigorous, systematic process for generating information or new knowledge. It describes new situations, events, or concepts, and examines relationships among variables and determines the effectiveness of treatments. The types of quantitative research are 4. There's the descriptive research, correlational research, quasi-experimental, and experimental research. How would you define descriptive research? Descriptive research explores and describes phenomena in real-life situations. New meaning is discovered, and the description of concepts is accomplished. And it helps to identify relationships. An example of descriptive research might be a study that looks at eating behaviors of male college students aged 18 to 21. Okay, and they might investigate what their eating behaviors are, and if they're looking at relationships, they might try to relate their age to particular types of eating behaviors. Correlational research. Correlational research looks at the relationship between 2 or more variables. It determines the strength and type of relationship, and it explains what is seen, but there's no attempt to look at cause and effect. So an example would be what is the relationship of physician recommendation to patients to obtain a mammogram and the rate of completion of a mammogram study. You will remember from your statistics course that the relationships are either negative or positive, and they vary from 0, -1 to +1. And the other thing that they're looking at is in what way do they vary? In what way do these relationships vary? Do both things go up at the same time? Do both things go down at the same time? Or does one go up while the other goes down, or vice versa? Quasi-experimental research does examine cause and effect relationships. There is less control by the researcher than true experimental designs. Samples are not randomly selected, and all variables in the study cannot be controlled by the researcher. It does involve implementing a treatment or an intervention. Okay? Now, what are the main characteristics of experimental research? In experimental research, there's controlled manipulation of at least one independent variable. It uses experimental and control groups. There's random assignment of the sample to either the experimental group or the control group, or groups. Experimental research is objective, systematic, highly controlled experiment for the purpose of predicting and controlling phenomena. In our case, it would be the phenomena of nursing. What is the aim of experimental research? It's looking at cause and effect relationships, highly controlled, objective, systematic studies, and it involves the measurement of independent and dependent variables. In these studies, subjects are in groups. They don't use the term subjects so much anymore as participants, so you might keep that in mind. So the independent variable and the dependent variable. Let's take a second to remind you. So the independent variable is that which is manipulated, and it involves the treatment. There are experimental groups, and there is a control group, and participants are randomly assigned to either group. Now, the dependent variable is that which is the outcome. That is what the dependent variable is, what we are trying to see what effect the manipulation through the intervention has on this dependent variable. All right, here's a question for you. The nurse manager collects data about hours worked, age, sex, and geographic area of the nursing staff over a 10-year period. What type of research would this be considered? Descriptive, correlational, quasi-experimental, or experimental? So think about it for a minute. Really, this is an example of a study, a descriptive study, looking at something in the real world, but there's no attempt to have an intervention or treatment. There's no random assignment. It's just what is out there. What concepts are relevant to the quantitative research process? Basic research, often referred to as pure research. This would involve a lab investigation on animals or humans in order to understand physiologic functioning or pathologic processes. An example might be chemotherapy drug trials, okay, where someone is randomly assigned to the treatment or the control group. There's a high degree of control and absolute random sampling. Applied research is called practical research, and this is mostly the type of research that nurses are doing now, although some are getting into the pure research or bench research. The next term is rigor. Rigor implies discipline, adherence to detail, strict accuracy, and precision. A lot of detail, strict order. Okay? The next term, control. Rules are imposed to decrease error. They want the dependent variable, the outcome, to be reflective of of reality. They want it to be true. They don't want it to be a figment of their imagination or luck or choice. Okay? Extraneous variables. These are variables that really are not that do not belong in the study and would interfere with the study findings and the relationships among the variables. Sampling. The study participants have to be a representative of the population being studied, right? So if you are studying older adults and heart disease, right? You don't want to have middle-aged subjects or younger adults in that as part of the selection process. Sampling is referred to as either random sampling or non-random. In non-random, there's no attempt to try to apply control here. Okay, so random sampling means that everybody who is selected to participate in the study has an equal chance of being in either the experimental group or the control group. Other concepts that are relevant are setting. So selection of the setting points to the location in which the study is located. So study of teenage high school students, and the settings are 5 high schools in one particular county. And the last concept is intervention, and that is what they're looking at here is the effect of the independent variable on the dependent variable. So the intervention can be an action, it can be a particular type of teaching, a particular type of drug, okay? And what they're going to manipulate is the type of teaching, right? Or the type of drug, right? And see the effect on some dependent variable. Applied research. This attempts to solve real problems in clinical practice. Studies the effects the intervention may have on patients, and it applies the findings in the real world on real patients. And the purpose is to generate new knowledge to improve patient care or to improve clinical outcomes. Now, you may have heard, or you may not have heard, of the National Institute for Nursing Research. National Institute for Nursing Research provides funding for research projects, and they emphasize those projects that are clinical investigations, testing interventions to improve patient outcomes. So applied research, right? So we're talking about intervention research. Applied research is also used to test a theory for usefulness in clinical practice. From another course, you may be familiar with Callista-Roy and the Roy adaptation model. Roy tested her theory in neurology units, and in particular pediatric patients. So why is rigor so important? In research, we're striving for excellence and adherence to detail. We have to use precise measurement tools, a representative sample, and a tightly controlled study design. There has to be logical reasoning employed, and precision, accuracy, detail, and order are required. What measures of control can be utilized in quantitative research? Measures of control will be rules that are followed to decrease the possibility of error, in part to determine and in part determine the design of the study. There are different levels of control depending on the study. Quasi-experimental studies are partially controlled regarding the selection of subjects, but experimental studies are highly controlled because of the precision of sample selection. Okay, take a moment to look over this slide, and it talks about control in the different types of research. And it also talks about the setting in which the research occurs. So descriptive research, uncontrolled. Researcher control is uncontrolled, and no attempt to control it. And the research setting is a natural one, or partially controlled. Correlational research is uncontrolled or partially controlled, and the setting is natural or partially controlled. In quasi-experimental research, researcher control is partially controlled, and the setting is also partially controlled. In experimental research, the researcher control is very high, and it's conducted in a lab. So this slide depicts the 4 types of quantitative research and the corresponding degree of control that is expected or used by the researcher, and it also discusses the settings. So where this particular type of research is usually and should be carried out. Extraneous variables. Extraneous, when you think of that word, it means things that don't belong when you're talking about something. So if I'm talking about research studies to you, right, and I start talking about something I saw on Facebook, right, or what the weather is like, right, I'm bringing in a lot of extraneous information, right, which is distracting. In research, extraneous variables occur, and they can interfere with the relationships between variables that have been hypothesized. The influence of extraneous variables can be decreased through sample selection and the use of defined research settings. So there's an attempt to exclude those factors that will muddle the findings. We try to keep things very clean and neat by excluding extraneous variables. What is sampling, and what methods are used to select a sample? Process of selecting subjects who are representative of the population. We spoke about that a few minutes ago. Random sampling, each member has an equal chance of being selected, and random sampling has the most control over who is going to be in the study, right? Now, a convenience sampling, they take anyone who is available. What type of settings are used in quantitative research? Natural or field settings, partially controlled and highly controlled. So a natural setting would be a researcher who's going to investigate some aspect of community health, and might go to a health fair and interview subjects or participants there. They might go to the campus student center, or a work setting, or a daycare setting, or a housing development. Okay, but it's a natural setting, right? And the setting is only partially controlled. A highly controlled setting would be a laboratory, a soundproof room, a testing unit, okay. This slide, what are the steps in the quantitative research, is figure 2-1 in your textbook. And they have a flow chart here for the research process involving a quantitative approach. So in order to conduct a quantitative study, you have to, first of all, have an idea or conceptualize your research study. You have to plan it, what you're going to do first, second, third. So you have to implement the project. You have to conduct it. You have to carry this out. You cannot skip steps in between. And finally, you have to communicate the findings. So the research process is different from the nursing process, right? So these are the steps of the quantitative research process. In the nursing process, right, your first step is what? Assessment. The second step is a diagnosis. Third is planning. Planning outcomes, planning goals, the intervention, whatever your action is going to be. And then the last step is evaluation. Going back to see, did the intervention achieve its outcomes? If not, why not? Okay. So it's not the same, okay, but in both processes you have someone who is approaching a problem with a structured format for looking at issues, for looking at patient problems, for trying to provide good patient outcomes, or in case of research, to generate new knowledge regarding patient outcomes. So research process is more complex than the nursing process. In the nursing process, you may have one patient or one family. In the research process, we're using these methods, right? Research methods, and usually larger groups of patients or populations, right? The nurse researcher uses clinical experience and their own experience. They review the literature to identify problems for investigation. They identify where there's a gap. What do we not know, right? Or what has not been studied, right? And from there, they identify their research problem and purpose. They review the literature. They pick a framework. Framework is like a roadmap that has particular concepts, like, for example, the self-care framework that's discussed in your textbook. An example would be in pediatrics. Nurses might, a research nurse might want to investigate the influence of therapeutic play involving dolls to teach pre-op patients about their surgery and what's going to happen to them, and look at the influence of the teaching on the patient's anxiety. So the intervention, the independent variable, would be the pre-op teaching, and they would probably have two intervention groups, one that received teaching and one that did not receive teaching with doll play. And the dependent variable would be measurement of the pediatric patient's level of anxiety pre-op and post-op. And did the teaching intervention make a difference in the level of anxiety? So that would be their research objective, their question, and their hypothesis. They have to decide what the variables will be, what design they're going to use, who is the population, and then from that, what is the sample that they're going to have, how are they going to measure, how are they going to collect the data, how are they going to analyze the data, what statistics will they use, and come up with the findings and discuss the outcomes. So we're going to go through each of these steps. So number one would be defining the research problem and purpose. So the research problem is an area of concern needing research for nursing practice. The problem identifies, describes, or predicts the research situation. The purpose comes from the problem and identifies the goal or the aim of the study. The purpose includes variables, population, and study for the setting. Second step, literature review. Collecting pertinent literature to give in-depth knowledge about the problem and understanding what knowledge exists to make changes in practice. Now, where do you find this pertinent literature? Where do you think? Okay, I suggest that you need to go to the published literature, which would be in our journals, right? And I would like you to go online, if you haven't already done so. Go to online, go to libraries, go to Stokes Library, and click on the tab for databases, and examine the CINAHL, CINAHL database, the OVID database, OVID, and the Cochrane, COCHRANE databases. Okay, so these databases contain all the journals that our library holds, and they make it possible for you to do a little literature search, a current literature search. Okay, so usually you're interested in literature that goes back about 5 years, and if there's classic research, you can go back as far as it takes you. Third is the study framework. Framework is the abstract theoretical basis for study, and it enables the researcher to link the findings to nursing's body of knowledge. Theory is an integrated set of defined concepts and relational statements that present a view of a phenomenon and can be used to describe, explain, predict, or control. So an example of a theory would be, in nursing, would be a self-care theory from Orem, right? Or Roy adaptation model. Nurses often use nursing theory, but they also use theories or frameworks from other disciplines. So they might go to psychology, and the theory would be possibly maternal infant attachment. In sociology, a framework might be social network theory. In physiology, the general adaptation syndrome. I direct you to see figure 2-2, which talks about decision-making model of self-care and work organization. Okay, so that's, once you decide on the framework, right, those concepts are used in a visual way to show the reader how things relate, okay, in this study. 4. Research objectives, questions, and hypotheses. These identify relationships between variables and indicate the population to be studied. It's narrower in focus than the purpose. Purpose is more general, and often specify only 1 or 2 research variables. So in your textbook, the author describes a research study that had this objective. The objective was to describe adherence to self-care practices of older workers with cardiovascular disease. And then the question, research question in that study is, what are the self-care practices of older workers with cardiovascular disease? And so hypotheses might have been generated that go like this. Older workers with cardiovascular disease who have part-time schedule practice more self-care behaviors than those with a full-time work schedule. That's just an example. All right, here's a question for you. A staff nurse is interested in the infection rates for patients who have an indwelling Foley catheter. What is the next step in the research process? Define the purpose, conduct a literature review, selecting study variables, performing a pilot study. I think this is too easy for you. I think that you would probably have already picked B, literature review, and that is the correct answer. 5, study variables. The variables are concepts that are measured, manipulated, or controlled in a study. We have concrete variables like temperature and weight, abstract variables that such as creativity and empathy. A conceptual definition gives meaning to the concept. The operational definition, the variable can be measured using this description. So the author of the study that your textbook keeps using, Dickinson, she provides a conceptual definition of the variable self-care. She also provides an operational definition, and she states how the variable of adherence to self-care will be measured. There, she mentions a specific tool that will be used, and it's called the adherence survey. Assumptions are statements. This all comes with study variables, assumptions, and the next slide, limitations. They all go together. Assumptions are statements that are taken for granted or are considered true. Assumptions are often unrecognized in thinking and behavior. Sources of assumptions are universally accepted truths. They are often embedded in the philosophical base of the study's framework. One assumption is all humans experience varying levels of stress. Okay. Another assumption might be you're conducting a study in which you're going to administer a survey that the person will have to read, right? Or write, right? So an assumption would be that all participants in the study can read, write, and speak English. Or all participants are full or part-time workers. Okay. Limitations. These are restrictions in the study that may decrease the credibility and generalizability of the findings. There are theoretical limitations that restrict the generalization of the findings, and methodological limitations that restrict the population to which the findings can be generalized. May result from an unrepresentative sample or weak design. So if you're using a correlational research approach or a quasi-experimental, there's a limitation on how much control you have over this sample. And so let's just say you're studying the self-care behaviors of Howard University college students, right? So whatever your findings are, they're really limited to the Howard University student population, right? They cannot be generalized across the U.S. or across the world. So those are our limitations. So the limitations have to be identified in the study. And when you're reading a research study in the literature, you want to note if there are limitations. That will help you decide if you want to use that research study if you want to implement some change on your unit. 6, the research design. Okay, the research design is a blueprint for conducting the study. It maximizes control over factors that could interfere with the study's desired outcome, directs the selection of the population, directs the sampling, directs the methods of measure, the plans for data collection, and the analysis. So the choice of the research design depends on what is known and not known about the research problem. The choice of the research design also depends on the expertise of the researcher who's conducting the study, the purpose of the study, and the intent to generalize the findings. The research design is stated in the methodology section of the report. problem-solving process, right? Problem-solving process requires you to collect data from reality, define the problem, make a plan, set goals, identify solutions, implement those solutions, and then evaluate and revise, right? Many times you have to utilize the problem-solving process within a research study. A research study can go over several weeks or months, and life may get in the way. So you may have to, you're having a problem collecting data. You have to define your problem. You have to identify a solution for obtaining that data, and evaluate, did this plan, did this solution, attempted solution, actually work? 7, population and sample. So you know from statistics that there's a difference between those terms, population versus sample. So in populations, all the elements that meet certain criteria for inclusion in study. For example, all women students in higher education. That's the population. Now, we might not be able to survey all the women students in higher education, but we could take a sample, a portion of that population, a subset of the population that is selected for study. For example, women students in 3 states universities in the Southwest. So Dickinson, from your textbook, uses a convenience sample of 129 adults over 45 years of age with coronary artery disease, enrolled in outpatient setting associated with a medical center. That was the sample. And eligibility criteria for participating as a member of the sample are listed. 8, methods of measurement. This involves assigning numbers to objects, events, or situations. It involves instrumentation, application of rules to the development of a measurement device or instrument, or selection of a valid, reliable instrument. Data are gathered at different levels of measurement: nominal, ordinal, interval, and ratio. You have to examine the reliability and the validity of the measurement tool. So make sure you know what the difference between reliability and validity. Reliability refers to the consistency of the tool to get the same results over and over again. Validity, does it measure what it is supposed to measure? An instrument is selected to measure a specific variable. The level of measurement will determine the type of statistical test that will be used to analyze the data. So Dickinson used the heart disease quality of life questionnaire. She also used the job content questionnaire, and she also used the patient health questionnaire to study depression. 9, data collection. There must be precise, systematic gathering of information for the study. The consent must be obtained from the sample. Researchers use observation, interviews, questionnaires, or scales to gather information, described under the procedures section of a research article. So what procedure was used? Here's a question for you. The nurse researcher is involved in selecting a sample for a research study on staffing ratios. Which statement best describes the difference between a population and a sample? Population is usually larger than a sample. A sample is usually larger than a population. Populations and samples are synonymous. There's no relationship between sample size and population size. Okay, which did you pick? I hope you picked A. All right, number 11, data analysis. You have a lot of data that you've collected. Let's say you have 100 participants in the study. You have a lot of data if you've given them a survey, right? And the data analysis takes all of that data and helps to reduce it, organize it, and give meaning to the data. And they use both descriptive and inferential data analysis. The analysis techniques are presented in the section before the section on results in a research report or journal article. They use mean, median, mode. They use percentages. If they're presenting correlations, they'll use a t-test that will discuss group differences. I'm sorry. Pearson R will be used for correlations, and the t-test is used for examining differences between groups. What are the components of the results section? The results section will contain descriptions of the findings after the data were analyzed, usually organized by research objectives, questions, or hypotheses. So in the results section, Dickinson stated that better adherence was reported by those with increased job control and workplace support. See how she planned her study, conducted her study, came up with data, analyzed that data, and then came to a conclusion, right? Better adherence was reported by those with increased job control and workplace support. What research outcomes are usually reported? It interprets the data findings in a meaningful manner. It involves forming conclusions and considering the implications for nursing. Suggests future studies. Generalizes the findings. And it also states if there have been any limitations. The sample was not sufficient to examine differences across different diagnoses. Dickinson actually stated the limitation. So here is a very nice display of the development of a research question. So pain is a prevalent problem for older adults. So the research team got together and they said, what are the significant components of the pain experience for community-dwelling older adults? For example, their perception, their evaluation, their response. Are there gender or racial, ethnic differences in pain experienced in pain treatment and access to pain medications for older adults? What are the disability outcomes for older adults with persistent pain? Does the number of co-occurring painful chronic health problems predict functional disability? So they came up with some important questions there. Okay? And that directed their literature review. And they went to do an electronic search of the databases CINAHL, Medline, and PubMed, using the terms pain, race, gender, disability, and older adult. The literature, which they reviewed, suggests that African Americans report more pain, have less access to pain medications, and more activity limitations. Few studies were in the older adult population, suggesting a gap in the literature. That's always important. Can you find a gap in the literature? Because that points to an area that for future study. There is an ample literature to support the relationship between persistent pain and functional disability. None of the studies investigating the relationship between pain and disability used a black and white older adult population. None of the studies conducted controlled for socioeconomic and sociodemographic variables. And the cascade model, based on the classic biopsychosocial approach, considers pain the key factor in the progression from chronic illness to social and physical disability. So there's their theoretical framework. The variables are listed: socioeconomic, sociodemographic variables, pain variables, and disability variables. And they came up with their question: what is the relationship among race, pain, and functional disability in older adults? Right? So they have their research question. Okay. When you're reading the journal articles, what components are contained in most research reports? About 6 different items here. There's an abstract, and that's a summary of the study in 100 to 250 words. There's an introduction, which states the problem, the purpose, the literature, framework that will be used, and hypothesis or hypotheses. There's a section for methods, and that describes the design, the sample, the setting, and the tools or tools. A results section, data analysis procedure. What statistical tests were used? And the discussion includes a report of the findings, conclusions, and implications. And finally, a reference list, all sources cited. What is the best way to skim a research report? Quickly review the source for a broad overview. Read the title, the author's name, and the abstract, the introduction, and the discussion. Examine the conclusions and the implications, and give preliminary judgment of the study. That's skimming it. Okay, let's just say you're interested in, hand washing. Okay, and there is a study, right? And it's only been conducted in outpatient settings, right? But you're an inpatient setting, right? So you will quickly identify whether or not that study is applicable to your beginning a research project, right? What factors are important in comprehending a research report? You need to know the type of study conducted. You need to highlight the key points. It's helpful if you have knowledge available on the topic. That's your knowledge. Expertise of the researcher. And is this study an original research, or is it a replication of a study that was done by someone else? We like to see replication studies, all right, because that gives strength to the findings, right? They were able to use the same study design, same characteristics for selecting the sample, same intervention, and the outcome, right? The results were the same. What were the funding resources of the teacher? What was the amount of the funding? And who provided the funding? Right? If it's a study that's been funded by NINR, right? They have made sure that researcher has the expertise, the knowledge, right, and has the proper research methodology. What questions are important in an initial research critique? So you'll be doing critiques of studies, okay? And as you critique, keep these points in mind. What type of study was conducted? What was the setting for the study? Were the steps of the research process clearly identified? Were any steps missing? Did the steps logically link together? Okay, put a star next to this slide, right? And keep it as a guide as you get assignments on critiquing studies. What other questions might be important when critically appraising a research report? Is there depth for accuracy, completeness, uniqueness of information and organization? Was the research process logically presented? Are there critical arguments in the discussion section? How would you communicate findings? Table 2-3 depicts research journals and clinical journals. So if you had a study and you wanted to get it published, right? If you were doing a quasi-experimental or an experimental research design study, you would go to the research journals. And if you did a study that was strictly applied, you'd probably want to look at the clinical journals. So communicating your findings, you need to be able to summarize major elements of a study and identify contributions of your study to nursing knowledge. Communicate your findings by presenting at professional meetings and conferences, and communicate your findings by publishing in journals and books. So in this case study, you work as a nurse in a psych unit of a local pediatric hospital. You and your colleagues are concerned with an increase in adolescent patients being admitted with depression and anxiety symptoms. In a recent staff meeting, the manager asked the nursing staff if they have any ideas on what interventions could be included in the plan of care. You share with the group a recent talk you viewed on the use of video games to alleviate depressive symptoms. Your manager and colleagues are intrigued by the premise that video games might help alleviate symptoms of depression and anxiety. Your manager requests that you conduct a search to find literature to support the potential purchase of a gaming system and software for your teen adolescent unit. So you begin your search by identifying a PICO question. Okay? We're trying to provide evidence for a particular intervention. You begin your search by identifying the P, population, I, intervention, C, comparison of interventions, and what goals or outcomes you hope to achieve. So P is adolescent girls who are depressed or anxious. I is using gaming software to decrease symptoms. C, compare outcomes for patients who use software to outcomes for those who did not. And O is decreased depression and anxiety from baseline assessment. So the search strategies based on PICO: design keywords to search the evidence, identify databases available, review current practice guidelines, very important, perform market analysis of gaming software and search for similar populations and settings. You find an abstract that supports the use of gaming. And here it is. And it's been published in what journal? Applied Nursing Research. Okay. Yes. Avatar-based depression self-management technology, promising approach to improve depressive symptoms among young adults. How will you critically appraise this quantitative research study based on the abstract? You would have to identify all the parts of the published research article. So this is just an abstract. You would have to go to the full journal article in Applied Nursing Research, and you would have to make judgment about all those items that we've been talking about this morning. Judgment about rigor, control, sampling, ethics, confidentiality, problem definition, appropriate measurement, appropriate analysis, logical conclusions, funding of the study. The nursing team has completed the review of the literature and has convinced management to purchase and implement a video system with software found to be effective at reducing symptoms of anxiety and depression. The research team will then evaluate the effectiveness of the intervention. What steps will the research team employ and include in the research plan? Okay, I'd like you to answer this. Go back through the notes and answer by writing down the steps that the research team will employ and include in the research plan. Okay, this concludes our presentation on Chapter 2. This is what I would call a heavy chapter. There's a lot of information, a lot of concepts, a lot of abstraction. If you have not read the chapter, please do. Use the integrity video to learn more, to expand your understanding of the concepts. And let me know during office hours if there's something that is unclear to you, okay? And we can talk about the concepts. I would like to see if there's some way that we as a class can get together for a face-to-face meeting. I'll put up a note about that in the announcements. If that's not possible, we will use office hours to get your questions answered. And I hope this has been interesting for you. It opens up a whole new avenue for you. It can really instill your practice with a lot of enthusiasm, right, for identifying problems, knowing where to go to find out more about the problem, and possibly participating in a research study that will improve patient outcomes. So thank you very much, and let us keep in touch. All right.